Okay, today we're going to talk about the importance of vaccinations and why you should vaccinate your kids. Typically in today's society, we tend to associate disease outbreaks and a record number of deaths with early time periods and their lack of medicine and resources to prevent such from occurring. However, history repeats itself, not because we don't have the medical knowledge or preventable measures, but simply because many parents choose not to vaccinate their kids because of health risk, personal views, and religious beliefs. The American Academy of Family Physicians has found a new study that shows numerous states and large metropolitan centers have an uptick in the number of non-medical exemptions from childhood vaccinations. The study found that in the past decade, the number of philosophical exemptions to vaccinate has increased 2/3 of the states that allow such. As a result, researchers suggest that these areas are becoming increasingly vulnerable to vaccine-preventable disease outbreaks. Although these beliefs and concerns are important, the health of a child is far more important, and science has proven that most vaccines are safe and beneficial rather than harmful and life-threatening. So, what are vaccines? Well, vaccines stimulate the immune system to defend the host against specific viruses. A viral disease causes direct harm to the cells, and so the immune system has to fight back and kill the disease. So when we get sick, our immune system is exposed to antigens, so the pre-existing immune response can work due to previous vaccinations. When you aren't vaccinated, your immune system does much more work and can negatively affect the body. Very harmful. So the benefit of vaccines in preventing disease directly follows the public through easy access, and the cost of treatment is publicly funded by most clinics and hospitals. So sometimes they provide free services to those who can't afford vaccines. So that way everybody can get vaccinated and we can prevent mass disease outbreaks. So there was a measles campaign back in 2002, and physicians sought to make the cost of vaccines more affordable than ever to promote people to get them. Before the campaign, the cost of the measles vaccination was 10 times higher than the average. So after, they were a US dollar of 32 cents, and okay. So another important factor is the types of non-vaccinators and how they have risen from historical differences and the thoughts on vaccinations from way long ago. So since the early 1900s, we have scientifically developed and widely distributed vaccines at our disposal. A wide distribution of people who do not vaccinate fall into 3 groups, which are hesitant vaccinators, late or selective vaccinators, and refusers. This contributes to the history by the number of parents who choose not to vaccinate and how the numbers have increased over the years. The American Academy of Family Physicians also states that 47 states have provisions that allow parents to exempt their children from receiving a vaccine if it contradicts their religious beliefs. And 18 states permit philosophical exemptions based on morals, personal, and other beliefs. So some of the consequences is like how children are evaluated in the ER. It's based on like their previous history, and like if you're not vaccinated, you're at the higher risk for other kids and other people in the hospital and the community. And so unvaccinated children require more testing and must find alternative ways to cure underlying problems because they have no previous history and it could easily be preventable. In order to protect the following generations, we must ensure that children get vaccinated and stay on schedule because large epidemic breakouts followed by death are bound to reoccur, and the death rates will become exceedingly higher. Thank you.
All right.